Hi everyone, Dr. Andrew Gutwein again, here bringing you the 2025 update for residency interviews. I had 2 points I wanted to make about pre-interview and 5 points to teach you about for during the interview. So starting off with the pre-interview. First, the USMLE had a scandal recently, I guess this was just over the last couple of years, where they had inactivated people's scores for suspicion of cheating. I wanted to really reinforce you guys using study tools for USMLE that don't lead you down the path where you wind up with the dreaded score not available. That's what it says on your USMLE transcript. That's what the program director sees if your score wasn't activated. If you have your score inactivated even once, even if you took it over again afterwards and did very well, you will probably be branded a cheater and have a good chance of not getting interviews. So please be very careful about that. The second pre-interview point had to do with postdoc research. A lot of people try to find postdoc research rotations in the United States. These might go on for months or occasionally even a year or two. And sometimes they have embedded in them a clinical aspect. Maybe you go to clinic once a week without attending, or you do some sort of time that is clinically relevant, not just research relevant. What I suggest is listing on your ERAS CV the clinical time that you did during that months or years separately as a different experience. And that way it pops to the program director's eyes and we realize that you did have clinical US exposure, not just research US exposure. And if possible, even get a clinical letter of recommendation based on that clinical time as well. All right, now on to the 5 points during the interview day. First one, don't use a chair with wheels if possible. I have a chair with wheels right now. Even just a little bit of rocking or swaying like that just really looks odd during a virtual interview like that. Try to sit still for the interview. Second, people sometimes tell people to use the filter that puts in behind you in the interview, some sort of graying out or another picture of something. I suggest don't use that. Those kinds of filters can accidentally all of a sudden cut off an ear and then it looks odd, or your hair, because it doesn't see something moving and thinks it's part of the background and deletes your body part. It's very distracting and not worth it. Put things that are behind you that reflect who you are, something you painted, some sort of project you did, something that you like to read, put them on shelves or the wall behind you. It can only add to make a connecting moment between you and the interviewer, because let's face it, you don't want to just be the doctor they want to hire. You want to make sure you're the person they want to interact with. All right, the third point had to do with pre-preparing cases and answers to questions. Lots of you, probably everyone, scours the internet to find, how should I answer various kinds of questions that are asked, and pre-prepares things, cases and otherwise. But then a program director or someone interviewing you might ask you a question that's a little bit different than the case you prepared or the answer you prepared. And we see this all the time where the person is then doing a tortured maneuver to try to make what they prepared fit the question that was asked. It comes across as very disingenuous. Or they may be looking at the side of their screen and we can tell they're like reading something that they taped to their screen to quickly remember an answer. You've done your preparation. Whatever the question is, just sit there, think about it for a second, and give a normal flowing answer. Don't worry about other cases you prepared or other things that don't quite fit that question. Just take a pause. If you have to even ask, can I just think about that for a few seconds, and then give a natural answer. And if it fits the cases you prepared, great. And if it doesn't, just do your best. All right, fourth point, body language. We are looking at the body language of how you answer questions. Don't sit with your arms crossed. It's a very closed posture. Just relax, sit in the seat, putting your arms on your knees like this, and natural smiling answers to people. Try not to look around at the notes that you've put on your screen. All right, last point I wanted to bring up. Don't assume the interview is over at some point. I've had too many times where somebody just ends the interview while I'm still having things I want to ask them. Wait until the interviewer signals in some way that the interview time is over, and if you have some last thing you want to close with, use it at that point. All right, those are my suggestions. These are, of course, building on previous videos, so feel free to go back and watch the other ones that are out there on YouTube that I put out, and good luck at the match this coming year.